everyone. Welcome to BioKorea 2020 Invest Fair, hosted by Korea Health Industry Development Institute. I am Hong Seon, today's MC. Today's event is to share pharmaceutical bio and healthcare companies' strategy as well as visions to investors. This presentation will be held by Solgent. Solgent is the first diagnostic kit supplier company, and it recently got an approval from United States Federal Emergency Management Agency as a supplier. This presentation will be done by President Yoo Jae-hyung from Solgent. Please begin your presentation.
Good to see you, ladies and gentlemen. I am Vice President of EDGC as well as Co-CEO of Solgent, Yoo Jae-hyung. Today I'll introduce genome analysis company at EDGC as well as its affiliate Solgent. First of all, Solgent is based on genome analysis as well as genome big data company, and its affiliate is Solgent. And the first DNA application platform company, My Genome Box, and molecule analysis equipment and reagent sales company, EDGC Healthcare. And if you take the company structure, it is like this. EDGC is the parent company, and it has My Genome Box and MediAge, which is a genome data utilizing company, and Solgent and Diagnomics, which utilizes genome analysis as well as disease prediction and prevention, and EDGC Healthcare, which works on in vitro diagnosis equipment and devices, as well as BioCure, which is a biomedicine company. First of all, let's begin with precision medicine as well as prediction and prevention management. Currently, the genome-based medical industry can be mainly divided into precision medicine as well as prediction and prevention management. As for precision medicine, for those patients who are already sick, we conduct a study to see what kind of drugs work well or not, and based on the study of the data, we can provide tailored treatment as well as drugs. And moreover, in the future, we can work on prediction and prevention. So people are paying a lot of attention on this field, and because we have accumulated data, we can see those patients or healthy people. Nowadays, we can see that some people may be exposed to some disease. So before that disease actually occurs, we can predict and prevent those diseases. The core technology that we have is cell-free DNA technology. Currently, we can use this technology to extract these mere pieces of DNA of cancer cells to preemptively conduct this study. Those mere doses could be done thanks to amplifying technology and noise deleting technology to analyze target genes. And this could be done by reagents and computing technology combined. So I would say this is one of the high cutting edge technology in the world. And next is bioinformatics. So based on this bioinformation, we can come up with more than 120 applications. And this is also part of our core technologies. Next is based on these technologies that we can come up with differentiated big data technology, and based on this big data, not only ordinary citizens, but also we can provide this technology to partner companies. Next is our DNA application platform application. And based on our study, we can enable any person to easily access the social media to learn about their genome information. Likewise, our business model is more than the conventional R&D, and now we have other sectors. One is clinic-based clinical test business, and another is customer-oriented business. First of all, the clinic business is providing data pieces to hospitals or clinics so that those hospitals can take and treat customers. And next one, customer-oriented business, is we provide those data pieces to customers. And in the past, everyone had to get a unilateral service according to the service trend, but however, nowadays we can provide tailored services, for example, tailored exercise, tailored food, tailored health condition, or even tailored cosmetics. So we can provide those tailored services based on the clinic and customer based services. We expect this genetics database business will be a thing in the future, and we can apply this to any industry that exists in the world. Let's move on to our core technologies. First of all, from the early age to nowadays, we sell this service called prenatal diagnosis. This non-invasive prenatal diagnosis can be done, and in the previous years, there was this amniotic fluid test to see the chance of abortion of babies. But thanks to this development, we can study childbearing mothers' blood to see those gene pieces in their fetus to see their health conditions. And this test can be conducted in the stage of 8 weeks to 10 weeks of pregnancy. And we have conducted more than 45,000 tests, and there was no single error, which means this is almost number one accuracy technology. And thanks to this, we are expanding to Southeast Asia, Middle East, and Europe and the US market. And based on our joint venture company in India or Hong Kong, Thailand, and Singapore, we're expanding to these nations and continents. Next is Babagen, which is a newborn baby test. When a baby is born, we extract one drop of blood from the upper rear part of the heel of a baby to see the chance of getting a hearing impairment or asthma before this baby can be a grown up, so we can treat them in the early age. And this technology as well, we're going through Taiwan, Hong Kong, Singapore, and Thailand to expand to Southeast Asia or Middle East, among other nations and continents. Next is cancer screening test. As I have mentioned before, just like the prenatal diagnosis, we collect data pieces from childbearing mothers, but this screening test, unlike the prenatal diagnosis, we can collect data from ordinary people. And if we successfully commercialize this before a person becomes a cancer patient, before even the first phase of cancer, we can preemptively take measures to prevent cancer, which is a very innovative technology. So this liquid biopsy, which is part of screening test, not only the conventional technologies, but also we can see if anti-cancer drugs work well or if there are any chances of cancer reoccurring. Likewise, EDGC, based on our genome analysis clinical test, now we are moving on to customer-based technology. And this year, thanks to the government's pilot project, customers can directly become clients by asking us for information, and we were chosen as one of the 4 government sponsored companies to provide those customers. They can get information directly from our company. And for example, nutrition, fitness, wellness, or healthcare, or moreover, the beauty industry can be included. And what we would like to boast about is that our company is the only company that provides Ancestry U service, which is a lineage test. I'll move on to that further in the near future. In the United States and European nations, the lineage test is very common. About 100 million people have conducted this test. This tells who their ancestors are. For example, in the United States, when they're 3rd or 4th grades, they would get a homework to see their ancestor, like check who their ancestors are. For example, a child's mother is from Germany, father is from Hungary, then this child has to know where the grandmother from the mother's side is from. But in Korea, this had been illegal, so our samples were mostly being exported to overseas. However, this year, now we can conduct this service, so we are the only service provider in Korea. A lot of Koreans, through this Yuhu service, they could learn about their ancestry. And many people say that Korea is a one ethnicity country. However, if we conducted this study, many people were from Chinese Han, or some were from Japan, some were from Mongolia, or some were even from Southwest Asia. Their ancestors were. So, based on continent or ethnicity, we can conduct this study, and on the same time, we collect a lot of data and categorize them into family names to keep providing this lineage analysis service. And what is very interesting about this is that we can compile those data, and those customers can receive reports from this application. So we are currently working on these various daily application services to tell if you are a morning person, or mosquitoes love your blood, or if you're good at alcohol decomposition, or what kind of wine as an alcohol suits you the best. So those daily life information can be analyzed by this application, which is a very interesting part. And generally, people just would say, "I'm just like my father. That's why I like cigarettes," or "I'm just like my mother. I can't drink much." But nowadays, we can provide this more scientific data to see inform about your genetics and DNA. So in the future, rather than having a vague idea, you can like count on this to select the best vitamin for you, the best wine for you, the best exercise for you. So this science can be embedded deep in your daily life. Currently, EDGC, as I have mentioned, we are expanding to Southeast Asia, Middle East, Europe, or the Americas, among other continents. And for the United States, we have Diagnomics, which is a San Diego-based affiliate, and BGI in China, which is the number two company in this field, and Phoenix Group in India. Through those partnerships, we are going to localize in different nations. Currently, because of the coronavirus outbreak, a lot of nations are being locked down, and nowadays, providing this service and localizing this service according to each nation is really important, I would say. And actually, I'll move on to introducing Solgent, which is an affiliate of EDGC. Solgent was founded in 2000, so this year is 2020, which is the 20th anniversary. So we have launched this slogan project called Solgent 2.0. So we are working on this project, and when we were preparing for this, we faced the coronavirus outbreak. As for the coronavirus, the background, like history of providing, working on this coronavirus vaccine is that when the Chinese agency of ours informed us the initial outbreak of the coronavirus, asking us if we can conduct study or analysis of this virus, but we answered that based on our current facilities or capabilities, we cannot come up with one. And then the agency informed us again, since this virus is getting more and more serious, I wish you could develop some kind of a medical kit. So on the 17th, when there was no patient at all in Korea, we began developing this kit. And as well known from the television, the CDC and a lot of companies, affiliate companies, are focusing on this specific field. However, we weren't informed about that, so we had to set a target gene based on our own studies and research. Since our genetics sensitivity is really high, so this was a very good decision. So in the previous years, there was Zika virus, SARS, and MERS virus, and our past experiences actually helped us out a lot. So Solgent, late in February, we got approval from the European market as well as an emergency approval in Korea. So we're exporting this to 54 nations. And in early March, we produced 3,000 kits per week. And on the third week of March, we produced 4,000 kits per week. And in April, we produced 5,000 kits per week. 5,000 kits means 500,000 people can test themselves. And As of this month, May, we produce 10,000 kits per week, which means 1 million people can test themselves. And among the 5 companies of this relative field in Korea, we are the only one that can run this amplifier enzyme technology. And we are the only company in Korea that can produce this amplifier enzyme in-house. Producing this enzyme by ourselves is very significant because recently, nowadays, in terms of logistics and retails, a lot of global companies are not providing materials to Korea because of the virus. But even under such circumstances, we can keep producing by ourselves. And second, since we produce for ourselves, not only can we keep working on increasing our production, we can cut down costs. And third, by producing those core ingredients by ourselves, we can differentiate in terms of quality control. Namely, Solgent, by having this core technology to amplify enzymes and by producing this on by own, not only to Korea but also any nations, we can show this high accuracy and precise level. And what proves this theory or logic is that we were the first country ever as a Korean company to sign a contract with the US Federal Emergency Management Agency, and the United States, the FEMA, assessed the capacity on 27 different companies, including Russia, everything. But our company ranked number one. That is why we were the first company to conduct this contract. And FEMA, as well as Fed government and our state government, like Canada, the Philippines, or Thailand, or Australia, or United Kingdom, we are signing these contracts. But in the United States, more than emergency approval, we are going to get an official approval from the FEMA or federal government or state government, and we can amplify this enzyme. So based on this, we're providing this technology to 54 nations. Now again, back to EDGC. Based on this technology, as a compound, EDGC will be at the center of the fourth industrial revolution, and as I have mentioned before, by collecting this big data and based on artificial intelligence and machine learning, and based on this analysis, we were able to produce this accurate data for patients. But on top of that, we can enable ordinary citizens to get informed and they can improve their daily life patterns, and we can provide prevention and prediction. So this will bring a major shift to this field. So as I have mentioned before, we were focusing on R&D, but now we are moving forward towards clinic and genetics TB business. So we are working on various fields. And based on the big data, which is a combination of all of these, we can produce applications and platform-based technologies. We can provide this to be applied to any industry that exists. So that is our ultimate goal. So this year we will keep collecting various data, and based on patient studies, we have collected 200,000 data pieces. And this year, based on the DTCD service, we will collect 500,000 data pieces, so which will be 700,000 data pieces. And this will open a new door for additional collaboration in the future. So our company is a genome diagnostic data as well as big data. So it was the end of my presentation. Thank you.
So we have listened to the presentation of EDGC and Solgent since this company is getting a lot of global attention. I look forward to additional advancement of your company. Thank you, Yoo Jae-hyung, for your presentation.